My speech today is about herpes simplex virus. Alright, what is herpes simplex virus? It is a large envelope double-stranded DNA virus. It can be divided into two categories, which is HSV1 and HSV2. HSV1, also known as herpes simplex virus, is commonly known as cold sore, and then HSV2 is commonly known as genital herpes, both of which are highly contagious. The virus is acquired through contact or shared object with an infected person. The virus enters through the skin or surface, which starts the replication and spreading process in the body. What it does is it infuses into the cells and multiplies in the body. It causes cell damage to skin, which forms fluid-filled blisters. And then each blister contains debris, cells, anything really to get or spread the virus. HSV does not cause cell death but remains dormant in a person's lifespan, and the contamination can be transmitted through saliva, body fluids, secretions, and oral sex. A couple ways of diagnosing it is through viral cultures, blood tests, and a PCR test. Most of these are the viral culture and the PCR test are honestly just swabs that they take in most of the surfaces that are contaminated, say around the mouth or the genital area, and then they just run some lab tests to it to confirm that it is the virus of HSV1 or HSV2. The detection rate is 90% when tested during early stages. So right when the blisters start forming is the best time to diagnose it or get it tested. And then once the lesions or blisters do start getting a little bit older, then it's less likely for you to be able to determine it is HSV1 or 2. There is no cure for HSV. It stays in your body either in a dormant or an active state. It does usually stay inactive in your body for a very long time. It will become active during stress or anything traumatic in your lifespan. So some signs and symptoms to HSV 1 and 2 is, well, when they are dormant, they are asymptomatic because, well, they're dormant. But when it is active, some signs are fluid-filled blisters around either the mouth or the genital area, depending on which one you have. Pain, itching, ulcers, scabs, red bumps, all that non-pleasant stuff, honestly. Here are some examples of what they look like. Nope. And then treatment, since there is no cure for it, there's not really any type of treatment to cure of it. Once they become exposed, like, you're stuck with it for the rest of your life. During an outbreak, though, most doctors will prescribe an antiviral medication, which it doesn't really stop it. It just helps with the symptoms and like the pain and the itching and all of that. For prevention is just don't come in contact with an infected person. Be very careful when having sex with a person. Always wear a condom. Be aware if you have an infection and if someone is infected, that way you don't stay around them or share any kind of object with them. And then here's my works cited. Thank you so much.